Good afternoon, Dr. Henry. Last week during your two briefings, in the first one you said we needed to listen to you and we needed to step back. And on Thursday you said we were at the precipice in terms of our contacts with each other. Are you confident that the measures you've taken today are sufficient, will be sufficient to pull us back from the brink?
Yeah, that is the question. And there was a lot of discussions that I had with my colleagues, with wise people over this weekend about, where was the focus needing to be? And yes, last week I called on all of us to start thinking about transitioning. We had a bit of a grace period in the summer. We were able to manage the cases. We were able to do the work of public health and allow people to have that time to get out, to be with others, to be with family, to travel a bit. We now need to put our focus and our attention on the important things, the priority things of getting children back into schools, of getting back into our workplace, and having that balance. It's not either or, but we need to have the economic and the health. So yes, these are some measures that we know are high-risk environments that I was hopeful would come down with the things that we had done before, but they haven't. And so now we need to take more action. And we have young people coming back for university, even though many of the classes are virtual. But we're seeing them as well, wanting to get together, wanting it to be like it was before. So yes, I do think these are necessary actions right now. It's going to be a challenging time for those businesses. And I think we need to all start rethinking about what we need to do to get us through the next few months as a community together. And these are some of the things that we'll need to put aside for now. And we'll need to focus on the things that we can do to stop the transmission and to make sure that our teams in public health are able to work with us in our communities to do that.
Fawn, do you have a follow-up?
Yes, please. Were there other measures that your colleagues suggested that you considered but rejected for now that you might have to consider if this doesn't work? And what sorts of things would those be, please?
Yeah, so there's always a spectrum of things that we can consider. I think we have always tried to look at what are the things that as you have probably recognized, I use orders as a last resort. And for things that affect all of the province, so provincial health officer orders apply across the province. So we do it for things where we know that it will make a difference, where we've seen transmission events. So we did it for vacation rentals, not just in one area, because we knew that it was the same issue in areas around the province. Same with this. So all of my orders and in discussion with my colleagues, we talked about, timing of things. Should we add this in or that in? What's the difference? And one of the challenges we have is that the way liquor licenses are for premises, it's a spectrum, and sometimes places can get around some of the issues by serving more food, and that's what we were trying to wrestle with and nuance, but it became really apparent that there were some venues that were just high-risk environments for staff, for patrons, and that we weren't able, and the people who were working in these places, in the banquet halls, in the nightclubs, were not able to effectively use the measures that we had put in place. So that's really important. There were, we have always, and my colleagues, we have talked about this. We've talked about this with the other ministries that we've worked on. We want to ensure that the measures we take are not going to have more negative unintended consequences. And we stopped everything in March, as you know, quite quickly, because we needed to take stock, we needed to find people, we needed to protect our healthcare system so that everybody could get care. And we took some very draconian measures. And since the very beginning, we have a team of people who have been looking at those impacts, whether they're positive or negative. And there have been many negative impacts of some of the public health measures that we took. For example, just the fact that we had to reduce the number of people in shelters and the impact that has had on homelessness, on people who have died from overdoses. So this is a rather lengthy healthy way of saying we want to do the least amount we can by order and make sure that we can support people to do the right things that they need to do for their own individual situation. And we've seen that work here in BC. So I'm confident that these measures will be helpful for us in that one area where we were seeing ongoing issues, and that the rest of us will work together to make sure that we can get through this fall and the rest of this pandemic together.
And just really briefly, tomorrow the Premier and Dr. Henry and I will be laying out some of the plans for the fall that hopefully learn some of those lessons from what we saw in March and April and May. And so public health orders, officer orders, are one way that we stop the spread. The individual actions of 5 million people across the province, the most important way that we stop the spread. And there are things that we can do in the healthcare system, and some of those in our plan for the fall we'll lay out tomorrow, which are also obviously part of efforts both to deal with the consequences of the COVID-19 pandemic and to stop the spread and to ensure that people are safe. So it's the extraordinary effort that's been led by my Deputy Minister of Health, Stephen Brown, and Dr. Bonnie Henry continues. And I think one of the extraordinary things about both of them and then the entire team that's been working on the COVID-19 pandemic within healthcare and within government is always having the willingness to learn lessons and to apply them to the next step and the next actions. We're going to be dealing with this pandemic for a long time. They're going to be today in the future. And we have to continue simply to learn from what we know, learn from what we see in other jurisdictions, and consistently do our best. And I think that's the spirit in which Dr. Henry and Stephen Brown have led the enterprise from a government perspective.
Vaughn Palmer did ask what other measures you may have been considering. It sounds like if things don't improve in the next few weeks, are we looking at possibly implementing a curfew or something like that when it comes to people spending time outdoors and socializing?
Actually, the curfew is not something we had considered. I think from the very beginning we've looked at risks, and there's a spectrum of risk. And we know that outdoors is less risky than indoors. What we see coming up is the fact that as the weather changes, we'll be less and less able to spend time outdoors. And I'm thinking about restaurants with patios, some of the adaptations that we've had to allow for more people to experience, safely in restaurants. So what we're looking at is how do we adjust coming into the winter months, but making sure we can still continue to have our surgical renewal program. We can still continue to have visits to long-term care, that we can continue to have our essential services and people going to work. We can continue with schools. So no, we weren't looking at curfews. What we're looking at are how do we encourage everybody to make sure we have in place the things we need to protect our healthcare system, to protect our most vulnerable people, particularly as we know our seniors and elders in our communities. And how do we adjust that? And we can do that safely. We can do that through the measures that we're taking now, through really important things. And one of the key tools that we have in BC is which is an order, is that every business or operation needs to have a COVID safety plan. So it's more looking at those plans and being able to modify them and put in place measures that can work in those scenarios, rather than trying to shut things down or trying to do it sector by sector. So that's what the orders are reflecting today, that we are looking at what can be done safely in the venues that we've mentioned today.